Okay, Vida, thank you very much. A new drug is helping people lose weight and keep from getting diabetes. It's called Byetta. It works to improve insulin production and has been helping diabetics to lose weight by reducing hunger. Dr. Jeff Gerber is a local doctor who has been prescribing the new drug. He says he has a patient who has dropped 90 pounds in less than 10 months. Good morning, doctor.
Good morning.
Is it Byetta or Byetta?
Byetta.
Byetta, okay, well, one of the two almost.
Sure.
Good to see you this morning.
Thank
Tell
you.
us about this. This is a lot of talk about this now. How long have you been using it, and tell us what it does?
I've been using it since January, and it's a wonderful new class of diabetic drug, and we refer to it as a smart drug. It is a hormonal drug, and we call it a smart drug because it only works in the presence of food. The scientific term is the incretin effect. But what's important for us to understand is that if you don't eat, it doesn't have any effect and it doesn't overstimulate the system. And this is compared to some of the other drugs that have been around for a long time. They're great drugs, but the way that they work is irregardless of food. You take that medicine and they act on the system. And in a sense, that can overstimulate the system and sometimes cause some of the problems that we see, including weight gain. Now, metformin is an older drug that does help with weight loss as well, but this is a new drug. It also has 4 areas of action, and that includes the pancreas, the liver, and the gut, and it helps to improve insulin function. The 4th area, which is the most exciting area, is the weight loss, and it works directly on the brain to reduce hunger and increase a sense of fullness.
For many people, they might have that sense of hunger, but they also have that addiction to food. They eat because it feels good or because they're used to eating a certain amount. Is it helping with that, or do you have to counsel the people along the way as well?
Well, most certainly. The drug presently is only indicated for the treatment of type 2 diabetics and for weight loss, but we have to counsel these patients. This drug does not work alone. In fact, the initial reports in the drug only showed a modest weight loss of about 10 pounds. But what we're finding in our practice, if we counsel patients, teaching them about carbohydrates and how it drives hunger and getting them to reduce carbohydrates along with this medication, this is where we're seeing the great weight loss, over 50 pounds, over 90 pounds.
We're almost out of time. I want you to tell us what you're holding. Is that an injection of some kind, or what is it that we're seeing?
So this is...
And while we're showing that, do you anticipate that it will be approved by the FDA for general weight loss?
That's the million-dollar question. We have to wait and see.
Do you think it should be?
Well, when you understand how type 2 diabetes works, it is the endpoint of a condition known as insulin resistance. And insulin resistance starts with being overweight. And it's basically a spectrum and a progression. So if this drug is really for the treatment of insulin resistance, then, may it help all overweight people. That has yet to be answered. Okay. We use it cautiously in patients that are type 2 diabetic and pre-diabetic.
Well, we'll continue to watch it. We appreciate you coming on this morning to talk more about it. Dr. Jeff Gerber, thank you.
Thank you.
Tom? Actually,